Hello everybody, my name is Alicia Prasad and I'm here to talk to you about Alzheimer's disease. So a few points before I begin. I will be talking about who is at risk, some of the signs and symptoms of Alzheimer's disease, how it is a public health issue, and I will be discussing some prevention, case management, and treatment strategies. So let's look at a bit of history. Dr. Alois Alzheimer was the first person to describe this disease. His patient was Auguste Dieter, the first person diagnosed with the disease. What is Alzheimer's disease? It's a neurological disorder characterized by neuronal cell death resulting in memory loss and cognitive decline. Who is at risk? The aging population, those with a family history of the disease, and those that have certain risk genes or deterministic genes. So 1 in 9 people over the age of 65 have Alzheimer's, and nearly 1 in 3 people over the age of 85 have the disease. There's familial Alzheimer's disease in which many family members in multiple generations are affected. Symptoms for this disease will arise before the age of 60 and as early as 30 to 40 years of age. However, true familial Alzheimer's only accounts for about 5% of cases. The risk gene with the strongest influence is called the apolipoprotein E4 gene. Scientists estimate that ApoE4 may be a factor in about 20 to 25% of Alzheimer's cases. There are also deterministic genes that directly cause the disease, guaranteeing that anyone who inherits them will develop the disorder. So scientists have discovered variations that cause Alzheimer's disease in the genes encoding 3 different proteins: amyloid precursor protein, preselin 1, and preselin 2. So there are 10 warning signs of Alzheimer's disease, and it's summarized here for us by the Alzheimer's Association. Memory changes that disrupt life, challenges in planning or problem solving, difficulty completing familiar tasks, confusion with time or place, trouble understanding visual images and spatial relationships, new problems with words in speaking or writing, misplacing things and losing the ability to retrace steps, decreased or poor judgment, withdrawal from work or social activities, and changes in mood and personality. Diagnosing Alzheimer's disease is not a simple task. There is no single test that can show whether a person has Alzheimer's. Careful medical evaluation, including medical history, physical and neurological exam, mental status tests, and blood and imaging tests will help physicians diagnose Alzheimer's. The disease is characterized in 4 different phases. The mild cognitive impairment phase has a duration of about 7 years, in which the disease begins in the medial temporal lobe. The symptoms presented would be short-term memory loss. Next, the disease progresses and spreads to the lateral temporal and parietal lobes in mild Alzheimer's. The symptoms include reading problems, poor object recognition, and poor direction sense. The next stage is moderate Alzheimer's, which has a duration of about 2 years, in which the disease spreads to the frontal lobe. Symptoms include poor judgment, impulsivity, and short attention. The last and final stage of Alzheimer's is severe Alzheimer's, which has a duration of 3 years. The disease spreads to the occipital lobe and causes visual problems. So inside the brain, you can see that the ventricles are enlarged in a person with Alzheimer's. With the ventricle enlargement, we can see that the cortex begins to shrivel up, and so does the hippocampus, which will impact memory. Alzheimer's disease is also caused by clumps of proteins known as amyloid plaques and tau tangles that grow in the brain. These protein strands twist and damage the neurons, and it causes the brain cells, the neurons, to die, and certain areas of the brain begin to shrink. So how is Alzheimer's a public health issue? The burden is large. Over 5 million Americans are affected to date, and the annual cost is $200 billion in the U.S. alone. Alzheimer's disease is expected to be on the rise by 2050 to about 16 million people. The impact is significant. Physical and emotional toll on patients and family members is extensive, and over $9 billion in additional healthcare costs, 70% of which are covered by Medicaid and Medicare. So, Alzheimer's disease is included in goals for the Healthy People 2020. There are ways to intervene. Despite no way to prevent, slow, or cure Alzheimer's disease, there are things that we can do to improve quality of life and reduce costs for those living with the disease. How can public health help? There's 3 functions that public health can do to basically alleviate some of the burden of Alzheimer's disease, one of which would be conducting surveillance, promoting primary prevention, and assuring early detection and diagnosis. So by conducting surveillance, we would be allowed to provide state-specific data on cognitive decline and Alzheimer's caregiving. This would basically provide opportunities to reduce difficulties and burden, as well as inform decision and policy makers. Next, we can inform, educate, and empower. So we have an opportunity to integrate cognitive health messages into other campaigns on healthy living practices. For example, pairing regular physical activity with heart health may promote cognitive health. It's also important to spread the message that everybody knows the 10 signs of Alzheimer's disease, because early detection does matter. And thirdly, public health will link to provide care. Promoting early detection and diagnosis will help allow patients to plan for future access to community services and reduce costs. So case management. Since there is no cure for the disease, there are some drugs that are available to help cope with the cognitive and behavioral changes. Cholinesterase inhibitors and memantine will treat the cognitive symptoms like memory loss, confusion, and problems with thinking and reasoning. Vitamin E is also usually prescribed. Living with Alzheimer's disease. So the focus should be on maintaining quality of life, maintaining daily function, mitigating cognitive behavioral changes and mood changes, and fostering a safe environment. In closing, Alzheimer's disease is a neurological disorder that causes cognitive decline and deterioration, primarily affecting the older population. Alzheimer's disease burden is expected to grow, and a public health approach will promote population-level change, increasing the quality of life and reducing financial and emotional burden. So management of the disease is difficult because there is no cure to date, but we are hopeful that technological advancements and research discoveries will be paving the way for new and innovative therapies. Thank you so much for listening, and have a great day.